An estimated 2 million Americans experience brain injury each year. Such injuries occur every 15 seconds. While thousands die each year from their injuries, millions more are part of a silent epidemic. Brain injury has deep and profound implications for the injured, their families, and their friends. It's common for survivors of brain injury to lose their jobs, become bankrupt, and fall out of relationships with loved ones. A brain injury can happen to you or me at any time. Please listen carefully to the information in this program in case this sort of tragedy strikes you or a member of your family. Today's topic is life after brain injury. Our guests are Bruce Baxley and Patsy Sholders. Dr. Baxley is a clinical psychologist in private practice in Solana Beach, California. He helps brain injury survivors regain functioning during rehabilitation. He will share his thoughts about personality and behavior after brain injury. Patsy Sholders is a brain injury survivor and a board member of the San Diego Brain Injury Foundation. She often gives talks about her personal experiences and the recovery process. Well, I want to thank both of you very much for being here today and being part of the Brain Injury Speakers Series. Patsy, let's begin by hearing your story, and I know you had a brain injury. Talk a little bit about the brain injury and how it's changed your life.
Okay, well, it's over 20 years ago. I don't talk about it very much, and I tease with the brain injury survivors because I don't remember it much. That's one of the main things that happens if you survive a brain injury, is that short-term memory loss is kind of big. I almost went through the windshield as a passenger. That's before people were really wearing seatbelts all the time, at least I wasn't, and ended up in a local hospital here in a coma and in and out of consciousness and in and out of apparently life for a while. So after that, I didn't remember things, and I just tried to get my life back. I didn't really understand that I was going to be different forever.
What does a brain injury do day to day in terms of changing your life?
Well, you know, they're different for everyone. I feel like I really got off easy compared to some of the numbers of people that I've interviewed with brain injuries. But first of all, if you survive something like that, it changes your perspective. You don't want to sweat the small stuff so much. It helps you to take yourself a little more lightly because you end up with some limitations that you possibly didn't have before. My limitations ended up primarily being with the way I perceive things and also the way my organizational skills. Although I look fine and everything, it's the times that people notice what is wrong with you that you try to overcome and try to not let anyone be aware of.
So how have your perceptions changed?
You know, it's hard to remember what I was really like before. All I know is that my mother looked at me funny for years afterwards, so I knew something was really wrong up there. It's just difficult. There's no roadmap for something like that. And at the time when I had my brain injury, there was almost nothing in the way of helping you get back with your life. I grew up with a disability, and having a brain injury is like losing something due to a disability, only it's much, much worse and can go on much longer as far as the feelings and the coping.
Right.
Because it affects you. It's the only thing that really affects who you are.
Right. Dr. Baxley, is her description of her injury and her life after the injury, is that typical of what you've heard from other survivors of brain injury?
Well, when you said everyone's recovery and everyone's injury is different, I think that's certainly important. And I think that the sense that everything changes and not knowing what's going to happen next or what does it mean or what to do about it, and other people looking at you and saying, what's wrong with you? And they don't really know either what sense to make of this or how to understand it or what to do to help a person with the recovery. I think that that is pretty universal.
Brain injury is often invisible, that it's a silent epidemic. And is that true, that people look at you and they don't recognize that you have
Right.
a disability that you might be working around or coping with?
That's exactly right. And you know, it turns out differently for some people as a result of their brain injury, end up with also physical limitations. That's almost, I don't want to say a blessing, but it helps relieve some of the stigma involved, because at least you can see they're walking with a cane or a walker, and so they might need a little help. Society cuts you just the slightest bit of slack. However, if you look like a normal person and you're standing at an ATM, for example, and you can't figure out for the life of you how to get money out of that darn thing, well then, you're kind of on the outs already.
Right.
And so you always just try to cover and pass as normal if you can. You know.
How many people in America have a brain injury? Do you have any statistics for that? And secondarily, how many people are brain injured and slip through the cracks and nobody really knows, so there's no statistic?
Well, since I thought someone might ask me about that, I decided to look on the internet and got some information from the Centers for Disease Control. Tell us that in America, 1.4 million people per year are having traumatic brain injuries.
And that's just TBI,
Right, traumatic brain
TBI
injuries.
being
Okay.
traumatic brain injury.
Unfortunately, 75% of those people are considered to have mild injuries, whatever that means. And they say that 20% of the people who are injured actually go through acute rehabilitation. And then there are all the rest of us.
Mm-hmm.
And is that all the rest of us a big number? That, I mean, a child goes out on a playground.
Let me tell you a story.
All right, tell
I
us.
started grammar school, and one day I was going out on the playground for recess, and a fourth grader, in a hurry, ran me over. And I was knocked to the ground, got a pretty nasty cut on my scalp, had to go to the hospital and get sewed up, and everything seemed fine, and my handedness changed.
You're serious?
Really?
I started school right-handed, and from that point I was left-handed.
How about that?
And no one ever figured out quite what was wrong with me. Until I finished graduate school, I didn't know that I didn't read like other people do.
Oh my goodness.
And so the question of how many people have injuries, I think a lot of people have injuries that the silent epidemic is nobody knows
Right.
that that's what it is.
Right.
Is it possible that learning disabilities are sometimes brain injuries in disguise?
I think that's certainly possible. I think in my case, the time that I spent with the well-meaning speech therapists, we never figured out anything about my reading problems.
Huh.
So I think that the problem with a brain injury is that often it happens and there are consequences that go unrecognized and untreated, and they make a living difference, and people might think, well, gee, Bruce is acting a little different, or Patsy's acting a little differently. I wonder what's wrong with her, and the symptoms that go following a brain injury can look like so many other conditions.
Let's talk about
Especially
symptoms.
in children.
Talk about symptoms, serious symptoms. What would you expect to see exhibited in a person after a severe brain injury?
Well, a severe brain injury, often a person ends up in a coma, going through surgical procedures to save one's life, and then has difficulty with every area of personal care and daily functioning for at least a few weeks or a few months after the injury, and they end up in a hospital, often life support, coming out of the coma, unable to remember anything, not knowing where they are, disoriented, confused, can't remember, don't know how to wear clothes, eat food, use the toilet, know when they need to go, are upset about things. Something's wrong, but I'm not sure just what it is. I don't feel good. And behavior problems occur. People get frustrated. Let's say I'm dealing with a world that is suddenly tremendously more complicated than the one I knew before my accident, which I don't remember I had the accident. And I can't reach my favorite coping tools to make it easier for me to handle things in that world. I think anybody's likely to be very upset, frustrated, scared, bewildered.
Patsy, I know because of your work with the Brain Injury Foundation that you're around other brain injury survivors. What sorts of comments do they make in terms of what worries them, or what has been the greatest change for them after an injury, after their injuries?
Well, I think, like I mentioned, the short-term memory loss. You know, anytime this is soft tissue, the only thing the brain knows how to do to recover from any kind of trauma is to swell up. And the more it swells up and goes against this very tight little helmet that we have, the more damage you're going to get. And supposedly the short-term memory is formed right up here on the top of the cortex, and especially in the frontal lobes, and then goes down into long-term memory later. So that's the biggest complaint I hear.
Would be memory.
Would be memory, and then also patience. You lose patience with yourself because you're having to fumble around learning the simplest things when you used to be able to be a Ph.D. or Olympic athlete or whatever it was. And patience from others. All of a sudden they can become role reversals. They're the caregivers now, and where you used to be in charge of everything or whatever. And so those role reversals and identity changes as a result of what you're differently able to do now, and then asking for patience and understanding from not only yourself but others, I think.
So classic after brain injury would be memory problems, the sort of frustration and probably anger and sense of loss and a lot of different emotions, maybe a changed set of different emotions than the person would have experienced before. And what about the executive function? Sort of this business about being able to keep your life together and get on with it and hold a job.
Right. Well, you know, with the short-term memory loss, multitasking goes out the window. And I know people who used to make over $100K a year. One guy I'm thinking of was a motivational speaker. And now he has failed the entrance exams, if they have such things, did you know this, at Target, Walmart, McDonald's, because it's not that easy to take money, to take orders, to be thinking of this, to be doing all these different things at once. And so someone who used to be able to quite handily do their job and support their life can no longer do that sometimes. And driving, that has a tremendous sense of independence. So depression, although you see that with any sort of loss, any sort of disability, can go on with a brain injury survivor for as long as 5 years. You know, trying to figure out, who am I? It's who am I again?
Well, that's a good question. I've heard survivors talk about, higher functioning brain injury survivors talk about feeling like they were in a fog, and they are coming, as they recover, they're coming out of the fog. And so, Dr. Baxley, this raises the question of, does personality change? Is the person a new person with a different personality?
I think that most experts would say that with brain injury there is personality change. I would disagree with that. I think that with brain injury there is disruption of function. It becomes harder to do many things, including sorting and organizing stimulation, not feeling overwhelmed, being able to remember, being able to think.
I'm listening. I'm just trying to figure out if I agree with you or not.
Okay,
Go ahead.
all
Keep
right.
going.
And so, in my view, we are human beings. We are not human doings. And I believe that a brain injury makes it harder for a brain to organize and carry out all these tasks. I think that changes how easy it is to do things. I think as a result of that, people often act and feel very differently than they did before. And the normal thing to conclude is, if I'm not doing everything as easily or the way I did before, that maybe I'm now a different person. I disagree with that.
Patsy, I gather you might not see it that way.
I'm still kind of sifting that out, but I understand where you're coming from with the functions. Of course, if you lose the function, then, but it ties so closely with personality, because if you lose the function, you start to go down the pike as far as your emotion that goes with it. How you feel about yourself is really so important as to how you relate to the world. I saw just last night this show about astronauts, and if they leave them too long in space with no stimulation and no social contact, then they start to go crazy, as it were. Their personality changes dramatically. And so...
I would say that we're all at times a little crazy. And
guess
I
so.
don't think that, I think that is more situational and driven by our experience rather than making us now a different person, in some way essentially a new person. And I think that in the recovery following a brain injury, it's often important for people to have the advantage of being among friends and people they know rather than trying to do all the challenging things that are involved in recovering in the company of strangers.
Let's talk about rehabilitation and recovery. What's the rehabilitation process like? How long does it take? And what about this rediscovery of self?
I think that the rehabilitation process is different for each person. The time frames are different for each person. I think that several things happen typically. One is that initially there is a settling of the dust, a clearing of the smoke, and sort of taking stock of my current situation, who am I, where am I, what's easy, what isn't, and figuring out what I need to do next. I think that in rehabilitation programs, typically there is a strong focus on regaining abilities to do daily activities like solving mobility problems, getting in and out of bed, hopefully regaining the ability to walk, focus on tasks like dressing and bathing and feeding and using the bathroom.
Which are important.
And those are clearly
Yeah.
very important things. And I think that we're quite good at helping people to regain those abilities or figure out solutions to those daily concerns. I think that it's the squeaky wheel that gets the grease. I think that often the problem of figuring out who am I now, how does that compare with who I was before, and what's going to happen to me next in my life, those are relatively more subtle issues that are often not as completely or consistently addressed in rehabilitation.
And we don't have time for it when we're trying to survive.
And
you
those
know.
are issues that play out over a longer period of time. We've talked about the aftermath of brain injury for the brain injured person, but what about for their family?
I think that family members are as bewildered as anyone else, and in addition, are usually willing to do anything they could possibly do to make everything better.
So what would be suggestions for them now?
Well, that's not possible to make everything better, so the family are in a real dilemma about how should they act, what can they do that would help. My opinion is that if we help the recovering patient to know that we still know who they are and that they are still important to us, I think that's a very powerful message, because if I'm brain injured and I'm not sure about who am I now and how good am I now and does anybody care about me, if I have people I hopefully recognize who are telling me that I'm still important to them, that they still love me, I think that's a very powerful message, and that's something that no one else in the rehabilitation team can do with credibility. Another thing that I think is important for families is to recognize that following a brain injury, immediately everything becomes serious. Most
Yes.
people don't live that way before a brain injury, and so if we can get families and patients to re-include some daily fun goofing off along with paying
Exactly.
attention to the recovery problems and those challenges, that can be very refreshing. I think it also enhances creativity, and I think recovery following brain injury is very definitely a creative process.
I suspect that humor is a very important something for family members and the survivors themselves to have. Would you make a comment about humor?
You have to be able to laugh at it. If you trip and fall on your face, you have to be able to get up and be the first one to make the joke, because otherwise you're just attracting the wrong kind of attention. You're getting condescension and pity and things like that. And also, you know, I read this card that said, you know why angels have wings? It's so that they can take themselves lightly. You know, it's humbling to have anything sort of wrong with you. But if you can find a way to find humor in it and find some relief, then it makes everyone else feel more comfortable with it too, and makes them realize you're just a person and you're able to see your own defaults.
Let's talk about resources. Can they go to the internet and find websites, for example? There is a National Brain
Injury Association, right?
And many states have brain injury associations.
And many counties and cities. It seems to be the grassroots that's kind of taking charge.
And what would the keywords be to type in a search engine? Brain injury?
Brain injury is a good one. Brain injury rehabilitation might be a good one.
Okay.
And these will pull up resources that a person can then make contacts and network from those contacts.
When one is looking for resources on rehabilitation following brain injury. It's important with your treating physicians. I think that hopefully your treating neurologist or your treating physiatrist will be able to help you to find appropriate therapies and programs.
Right.
And after inpatient and outpatient treatment is finished, hopefully to find other resources in your communities. And I think that those are crucial.
Right. It should start probably with the rehab centers because that's where people usually end up. Yeah.
Well, if there's one around.
Yeah, if
That's
there
where
is one
people end
available.
up.
Prevention, obviously, prevention of brain injury is a whole lot better than, having the aftermath of, the cure,
Yeah.
exactly. So what are, let's take stroke as a specific, because that's something that happens frequently to people. And I guess specifically, let's focus on why it's important if someone thinks they're having a stroke to go to the emergency room quickly. Right. Dr. Baxley.
I think that certainly a stroke is a different type of brain insult, and it's circulatory driven. And I think that when someone thinks they may be having a stroke, perhaps they have a new weakness or numbness, a new difficulty speaking, confusion, and think that that might be a stroke. It's important to get to an emergency room because the sooner you get there, the less damage is done, and some of the damage can be reversed. There are now treatments that can help to dissolve a blood clot if a person has an ischemic stroke. And if that is done within the first 3 hours from symptom onset, often that leads to dramatic improvement in recovery of function.
So the message is, if you think you may be having a stroke, don't wait. Go to the emergency room now. Don't wait till in the morning.
Right.
Good.
Right. Also, if a person is having a non-ischemic stroke or a hemorrhagic stroke, if that is being treated rapidly, that can reduce the damage that occurs as well.
And even with traumatic brain injury, a well-equipped emergency room or hospital can prevent brain swelling,
Right.
which can prevent the death, the secondary injury of the death of healthy brain cells from the swelling. Patsy, let's talk about brain injury. Has a certain something attached to it that involves loss. Specifically, there's may be a loss of the future after a brain injury. Mm-hmm. A person is not who they were and who they might have been.
Right.
Did you experience personally a sense of loss of future?
Yes, it's sort of a real confusion because you were heading in a certain direction, and quite often you're going there at a fast clip, and all of a sudden it's a big interruption to your life. Myself and whoever else I know that has had a brain injury, you think you're still there because you can't remember all that's happened to you. And you just want to scramble to recover. And when you can't, it can lead to, like I said, a lot of depression. You really need a good support from family, loved ones, whoever. And you need patience with yourself and from others. It takes a long time to rework your perspectives, your goals, to figure out how can I contribute again. As social animals, we have to be able to contribute to our world, especially to the lives of our loved ones. And if we don't feel we're able to do that, then that can be tremendously disheartening, to say the least,
Sure. Dr. Baxley, do you find that in the patients who you've dealt with, this business of loss of future?
I think that many people I've worked with who have had traumatic brain injuries are very uncertain about what comes next, are very uncertain about who am I now, what are the things about me that make me who I am and what matters. And I think as people we are blessed and cursed with an inclination to try to make sense of our experience. Sometimes the sense that we make of it is not accurate or helpful or useful in the process of getting life going again or making life good again. And I think that unless those issues are looked at and discussed and examined with someone who can think about that clearly along with the person with the injury, often people are very disabled when it's not really necessary.
What's the most helpful and positive message of hope that you would have for a family who would see this program and has a brain injury survivor or family member?
I think that brain injury is a disruption of function. It makes it harder to do things, and our brains are incessant puzzle solvers. And if we provide opportunity for brain and body to fiddle with or work on the puzzles that came with the new injury, and we don't give up, and we don't get too upset about how long it's taking or what goes on in the recovery, that we now know that brains can reestablish tremendously functions that were lost.
Yeah. And Patsy, what about you? What message of hope would you have for families of brain injury survivors?
Well, I think you brought up a good point. It's amazing, the human spirit, how creative we can be to find ourselves in whatever situation and find a way to get clear or a way out. I know many people that have had brain injuries that actually, in retrospect, will say, you know what, actually, I wouldn't have ever asked for that, but it gave me a better life afterwards. One guy I can think of used to be kind of a big party animal, was rich and everything, but now, after gaining some empathy, he's started one of the biggest support groups, around with stroke survivors. And he goes to Sacramento, he goes to Washington, D.C., he marches all over the place to talk and educate and, help the cause.
So brain injury brings a different view of the world or a different perspective, and certainly probably some limitations. And yet in that, there's the silver lining.
Well, and there always is, but it really depends on, I guess, who you were before, but then how much support and love, basically, you have from others. It takes time. There's nothing fast about it. And it does make you a different person,
I remember listening to a fellow who had been brain injured as a soldier, and he was told, and his family was told, that he would never be able to walk or talk or function again. And he gave a speech to a group of rehabilitation professionals, and he said that recovering from a brain injury, you can do anything you want to do as long as, 1, you don't give up, and 2, you don't skip any steps. Right. And I thought that was very important.
Yeah, no kidding. Well, I want to thank you both very much for being here today and being part of the speaker series. Thank you.
It's been fun.